Hello and welcome to Standard 14. Standard 14 looks at handling information and again we've covered this throughout the other standards and therefore you should have a really good understanding by now. So let's look at some of the things around handling information. Obviously confidentiality is a really important process of everyday rights. It's a basic fundamental principle and again a human right as well, that we don't go around talking about people. It forms part of our relationships, so therefore if we're trying to build a therapeutic relationship with our customers, we need trust, and for that to happen we need to handle people's information in a safe and secure manner. But think about it, it's not just the customer's information that's being handled, it's yours as well. We will handle information on you, such as your criminal records. Imagine if you had something on your CRB and we started to disclose that to other people. How would you feel if part of your privacy had been breached? Therefore, we need to ensure that we work to the agreed ways of working. We need to make sure that we follow the code of practice in which you downloaded in section 1 and you understand those. It's important that we follow the GDPR principles. So therefore, we're only going to use online materials that are safe and secure. If we do handwritten records, we make sure that we're only writing things that are factual and non-judgmental. We need to be mindful about things that we are writing and where we're leaving those documents. The reality is, in people's homes, we're leaving care notes for every day about bowel movements, medication, likes and dislikes, moods and affect. Imagine if somebody picked that up and started to read it. How would you feel if somebody had read all of that private data on you and knew the last time you went to the toilet? It's important that we follow the laws and the rule of law. The law says we need to be fair and transparent, and information is shared on a third-party basis. So for example, we may share care records with CQC, we may share them with social services, or alternatively, we may share them with the NHS. But it's important that we only share data, A, if it's consented to be shared, and B, as long as we're using it in the right manner. So first of all, personal data that can only be obtained, we need to make sure we have a reason to obtain it. So we shouldn't be gathering data on people that we don't need. 2, we need to keep it to the minimum. We need to keep information as a minimum amount, so we don't need to keep things that's not necessary. And we don't need to keep it beyond a period of time. So once we've finished working with somebody, we shouldn't be keeping data for no apparent reason. We need to make sure that the data is accurate. So in other words, when you're writing your records, make sure that we've got the spelling right and that it reflects and reads what we want it to read. We need to think about storage. Data no longer required should be removed, so data that we don't need must be removed. The problem is in care, we keep care records for up to 7 years due to health reasons and other complications and auditing purposes. We have to make sure it's stored correctly, and we have to make sure that we're adhering to the integrity and the confidentiality of it. Now let's move on and say your customer asks to see their care records. They have the right under the Freedom of Information Act 2000 to see what care professionals are writing about them. That's important for you to know because you have care records based on you. So you have a right to read what people are holding data on you. Normally, we have to get it in writing and we gain consent, and it would go to the Freedom of Information Officer who would review a request, and they would arrange a time or a location and a certain format for the data to be reviewed. The Act looks at other people such as local governments, local authorities, doctors and surgeries, schools and police force. So again, there's an array of things there in which we can look at. Handling information needs to be done in a professional manner. Now, you'll hear things such as in the past, for record keeping, you must only use a black pen in records. Again, that's now a myth. That was all part of photocopying and scanning data. Nowadays, things are much easier to photocopy and we can see clear. So, black pens used to be the only way of recording. We now say it doesn't matter in health. Here, if we are using data and we're using electronic data, it must be password protected. So again, people can't just log on and see things. We may use assistive technology. So for example, we may be parts of WhatsApp, we may be using speech and translation stuff. We need to be mindful where that data is going, and if we are using social media sites, that they're encrypted and people's data doesn't leak. So it's important that if we are using assistive technology, we're only using approved recommended ones. So for businesses, we should be using the WhatsApp for Business software, which has an encryption service in it, ensuring that people can't hack in and read other data. So again, it's important that we do that. On websites as well, if we are using things, you'll see up here you've got padlocks, and if there's padlocks on the site, it means the site's secure. So again, if we are going onto sites and we are filling in forms for maybe our customers, and we're putting in card details, it's important we know how to transmit patients' data as well, so ensure that the site is secure. Care plans are obviously an important part of our world. It's an important part of what we do. However, it contains so much personal data on people. Therefore, it's really important that we don't leave them lying around and that they're always in a secure location in people's homes. Again, looking at the 6 C's, we've got care being a fundamental principle, making sure that we're working to the central part of what we do and the person's at the centre. People may be concerned about their data. Most care companies, not most, all care companies will be registered with the ICO, the Information Commissioner's Office for Handling Data. If we breach any data, we can be prosecuted in law, meaning we can receive fines or even imprisonment if the breach is dangerous. So it's important we have concern processes, and again, most companies will have their normal complaints procedures in which you'll find online or via your policies and procedures. All policies, all companies will have a way of reporting the concerns, and again, this normally goes to your manager as the first line. It takes courage to report things. So not only do we have the Information Commissioner's Office, the ICOs, we also have CQC, which will listen to any concerns around breaches of data. Let's look at some of the knowledge now you need to complete this standard. So, the first one is a table, and it's asking us to describe different ways of working, and I think we've got 2. So we need to include categories of ways of working and how this can affect our recording, storing and sharing of information. You need to list 2 legislations, so for example GDPR and Freedom of Information Act, just as an example, and again you're going to list what they are and how we work towards those. So that's the first one. The second one then, we've got another spider graph in where we're securing secure systems for recording, storing and sharing information include, and you're going to list some of the things in which we use. So for example, you may be using emails, you may be using chats, such as WhatsApp to talk to your team. You may have online care planning systems, so again just think about those and how you're using them. Here we're going to use these words and we're going to provide an explanation of systems for recording and sharing of information, and you need to use the following words within a paragraph. So we're just going to write a statement using all of these words. Finally, moving on, you're going to have a series of questions with simple yes or no. You just answer the ones in which you think are the right answers. And then finally, here you need to think about a statement from the above and explain how and whom you would raise the concerns to or whistleblow. So think about, again, your whistleblowing policy, safeguarding and raising concerns. So that's the end of section 14. You will have other training out in the workforce, so you'll be shown the care planning systems, you'll be shown how to record and store information, and again on a monthly basis normally you'll find your care records will be quality assured and you'll get some kind of feedback from your supervisor. When you have your supervisions and appraisals, it's worthwhile asking your supervisor about the quality of your care notes, because it's important that when we write care notes, it reflects the care in which we've given. Remember, if you make a mistake in recording information, you simply put a line through it, an initial. If you make errors, we don't scrub it out, we just keep a nice line and then we just put a new entry in. So some of those processes are there to be mindful of as well. I wish you all the best of luck. If you want to fill in your workbook and email over your tutor, you'll receive your feedback. I'll see you in the final standard, Standard 15, Infection Control.